Good afternoon, everyone, and welcome for today's webinar. So let me first introduce myself. My name is Ulrika Renström-Loy, and I'm a technical officer with WHO headquarters and HRP, and I will be moderating this webinar today. So our topic today is the new comprehensive abortion care mobile app that we have developed, and we will be hearing from 3 experts speaking on this subject during this 1-hour webinar. But before we start, I have some few suggestions and tips. So first, I would like to inform you that this webinar will be held in English, and the webinar is recorded, and we will share the recording with all of you that have participated in the webinar or registered for the webinar. And to be considerate and respectful for everyone and for the presenters, we have you all muted. Your all attendees are muted, and we have designated some time for addressing questions. So you can submit questions at any time during this webinar. And to submit your questions, you go to the Q&A box, question and answers function here on Zoom. So look for the icon that says Q&A. And please use the Q&A function and not the chat function, because we won't see then your questions. And the last thing, if you have any technical questions or issues, please send us a message. Also, you can put it there in the Q&A box so we can see it. And this webinar today is hosted by the Prevention of Unsafe Abortion Unit at WHO in collaboration with IBP Network. And if you like this webinar and would like to be invited for future events similar to this one, make sure that you register for the IBP network, so you will get invites. And this is free and takes a few minutes, and you can sign up by visiting the website that you see there on the screen. And now, so let's start. So I'm pleased to introduce Dr. Bella Ganatra. She will open this webinar. And Bella Ganatra is the unit head for the Prevention of Unsafe Abortion Unit at the Department of Sexual and Reproductive Health and Research here at WHO headquarters in Geneva. So please, Bella, I give the floor to you.
Thank you. And on behalf of the unit, the Department of Sexual and Reproductive Health, and our special program HRP and the IBP network, it's our great pleasure to host you here in this webinar to introduce the latest in a series of tools related to the abortion care guidelines. For those of you who have been following the work that we do on abortion, you are all familiar with the comprehensive update of the abortion care guideline that was issued last year in March. But as we all know, the guidelines contain recommendations at a fairly high level. And in order to translate them into real-life practice, we need tools. As part of the process of converting these guidelines to reality, earlier this year, we launched the Clinical Practice Handbook for healthcare providers. And this is a further tool to support healthcare workers, is a job aid in being able to make evidence-based decisions in providing clinical care on abortion. So this is like the digital version of a pocket clinical care handbook. And all of the information within this digital tool is, of course, aligned to our guideline and recommendations. So we're really, really excited that you can join us to hear much more about how this tool was developed and how you can use it in your work. So Ulrika, back to you, and let's get started.
Thank you so much, Bella, for your opening remarks. So now let's please welcome our first presenter, my colleague, Dr. Farid Abubekar. And he's an obstetrician and gynecologist, and he's currently working as a consultant at WHO and the Department of Sexual and Reproductive Health and Research. And Farid, he has been leading the development of this CAC application, and he will now present for us the process and the methodology that we have used. So over to you, Farid.
Thank you, Ulrika. Hello, everyone. Thank you for joining us today. It's a somewhat unique product that we usually call a digital decision support tool for provision of comprehensive abortion care. In the next few minutes, I'll take you through the details of the app, which is one of the derivative product of the recent WHO abortion care guideline. This application is developed as a digital. Can you proceed to next slide? Yes. Next. And next. Yes. So this application is developed as a digital decision support tool for the provision of comprehensive abortion care, and it complements the clinical handbook for quality abortion care, which was published a few months back. And both these products are derivative product of the abortion care guideline that was published last year in March. Next. So the main goal of the tool is to support health workers in the process of decision-making by implementing WHO standards and guidelines for the provision of quality abortion care. And this is achieved by providing checklists and contextual information for the health worker to aid case management, which will minimize errors in provision of medical abortion and facilitate tailored post-abortion follow-up and appropriate referrals. The app is also expected to aid health workers in the decision-making process, in which specific recommendations are presented to the healthcare provider for consideration, and these are based on the characteristics of the individual patient. Next. So this application will be available to a wide range of healthcare providers via mobile devices to be used in the context of healthcare provision. When we say we were including all category of healthcare providers for whom provision of abortion care is within their domain of task. It will serve as a digitalized job aid that combines the information of care seekers with the health workers' knowledge and WHO clinical guidelines to support service delivery. In the long run, the app is also expected to increase the capacity of care providers as it guides them through the algorithms and best practices to support service delivery and that are according to the WHO clinical handbook. Next. So this app can be used to support clinical decision-making by health workers during care provision. However, the app is not designed to capture and store health information of individual care seekers, which means this cannot be used as a form of electronic medical recording or a follow-up tool to monitor patients' progress. The tool is not meant to supersede or replace clinical judgment. In addition, the application is not intended to be used as a provision of training or education material or a self-care guide. Next. So the application contains all the information that are essential to assist clinical decision-making. It also guides health workers to make care seekers, enable them to make an informed decision as it walks them through the different steps of comprehensive abortion care. Next. Okay. So all the recommendations that are within the app are from the abortion care guideline in the clinical handbook. Next slide. So the first page is, we have, can you go back one slide, please? So yes, next slide. So there is this will be the landing page that care providers will get after the initial download. The first screen that they will get is just the initial setup where providers will put their country of practice and professional category, but that is just a one-time setup screen. And after launching the application, this will be the landing page where providers will have access to the evaluation format as well as the relevant resources in new series from WHO. Next. So as we said earlier, the app walks the individual through the various steps of comprehensive abortion care. Similar to the clinical handbook, the different categories are bundled into pre-abortion, abortion, and post-abortion options. Next. The other neat feature of this app is the menu of option, which gives a quick shortcut access to various aspects of care, such as determination of gestational age, eligibility assessment for medical abortion and pain management regimens, post-abortion contraception options. These are all included as quick access through the menu of options. My colleague Polyfill will give some details about this later in the presentation. Next. Yes, so there is also a resource section that contains all the WHO guidelines, toolkits, publications, infographics that are relevant to comprehensive abortion care. So in a way, the application is serving as a one-stop shop where users will have access to all relevant resources that are needed for provision of quality abortion care. Next. The other feature that is most relevant for us going forward is the feedback section. So this is where users can send us their feedback and comments that we will be reviewing for future updates. We have already received a few very important and relevant feedbacks that we will be addressing, but you are all encouraged to use this option to send us the feedbacks that you may have. Next. So the app is now available in app stores. It is both available in iOS and Android. It can be downloaded for free, and you are more than welcome to use it in your clinical practice and send us the feedback you may have. Next. Thank you. This is what I have for this panel today. It's over to you, Rika. Thank you.
Thank you so much, Farid, for this presentation. And if you have any questions for Farid, please add them in the Q&A box and we will be able to answer them later during the Q&A session at the end of this webinar. Okay, so now let's move on to our second presenter. That is Jane Sayok, who is the Monitoring, Evaluation and Learning Advisor at Figo, the International Federation of Gynecology and Obstetrics. Jane, she's supported the field testing of this mobile app, and she's working with the OBGYNs and other healthcare providers from Ethiopia, Kenya, Rwanda, Uganda, and Zambia to collect feedback in order to improve the application before it became live. So over to you, Jane, to share your presentation with the audience.
Thanks, Ulrika, for the introduction, and thank you for inviting me to speak at the webinar today. Really excited to talk to you about the Comprehensive Abortion Care app. Next slide, please. Before I dive into the app and the field tests, I wanted to share some background about Figo and our work in safe abortion. And then I'll talk about the field test, the testers who took part, some of their feedback, and the overall reception. Next, please. So Figo is the International Federation of Gynecology and Obstetrics. It's the world's only alliance of national societies of obstetrics and gynecology with over 130 members. Our mission is to improve women and girls' health and well-being, reduce disparities in healthcare, and advance the practice of obstetrics and gynecology worldwide. So as part of our work, Figo leads on a global program of activities with a particular focus on Sub-Saharan Africa, Latin America, and Southeast Asia. Our work supports national societies of OBGYNs to grow and strengthen and advocate to make a positive impact on the lives of women and girls. Next, please. Figo as an organisation is dedicated to improving access to abortion care. So Figo regards reproductive choice, including access to safe and quality abortion care, as a basic and non-negotiable tool for ensuring the human rights of every woman and girl are met, not just in one region or country, but globally. And so as part of our work, our projects have worked with 12 OBGYN societies and 2 regional OBGYN bodies to act as advocates for safe abortion in their regions. We also have our Safe Abortion Committee made up of Figo volunteers who all work towards the same goal. And lastly, we have a number of position statements available on safe abortion, including on telemedicine, the ones you can see on my slide, conscientious objection, as well as calls for total decriminalisation. So with our work in mind and the official relationship between WHO and Figo, the team at WHO kindly reached out to Figo to conduct a field test for the new abortion app. Next, please. So earlier this year, a draft or a beta version of the app was made available to a small number of OBGYN doctors and other healthcare providers. And we worked with OBGYN societies in 5 English-speaking African countries and identified providers to take part. And the overall aim of the field test was really to test the use of the application among health providers, working across different settings, to conduct a survey among the providers at the end to learn about their experience and obtain feedback about the app. So once we'd identified the providers, we supported them to install the app on their devices and gave them around 4 weeks to start using the app in their day-to-day when they're dealing with patients seeking abortion care or post-abortion care. And once that 4 weeks was up, we sent out a survey to capture their details, how they found the app user interface, the use of the app, the features that were on there, and for general comments as well. And we took the results, analysed the data, and prepared a report for the team at WHO. Next, please. So in terms of who the testers were, we felt like we captured a diverse range of providers. So as we said, we had testers from 5 countries: Ethiopia, Rwanda, Kenya, Uganda, and Zambia. There was a mix of male and female providers, although a little bit more leaning towards male providers, and a mix of OBGYN specialists, general practitioners, midwives, a nurse, and a resident as well. In terms of their workplaces, again, it varied from public institutions, teaching institutions, and a couple from private practice as well. And the length of their experience ranged from 2 to 32 years. So we felt like we managed to get the diversity we were hoping for. And so let's look at what they thought about the app. Next, please. So we're really happy with the results of the survey. 21 out of the 23 users reported being satisfied or highly satisfied with the app and rated the likelihood of them using the app and recommending it to colleagues very highly as well. So I won't read out all of the comments that we received, but I've put several of them down so you can get a feel for some of the comments. There were comments around the app itself being very user-friendly and easy to navigate, very useful as it's possible to use it offline, and it offers options without having to search through a browser. There were comments about how it made the health providers work easier without having to refer to other documents, and having the information at the end of their phone was very, very useful and ensured that interactions were very comprehensive with the client. So very, very good feedback. We were very happy with it. And of course, we also had some comments to improve the app, and I'll speak a little bit about that next. Next slide, please. Thank you. So overall, the survey data showed really good reception to the app by the providers. We made the conclusion that the app would be a very useful tool that supports healthcare providers at all levels, provide information and care that aligns with the WHO guidance. As I mentioned, there were adjustments, and that was a big part of the field test, was to improve the app with based on the comments. And some of the recommendations that later led to changes were things like improving usability, the navigation and the function of the app, ensuring that the app had gender inclusive language, updated clinical information in parts, and overall just fixed a few errors in algorithms that were identified. And just to end on this note, that from Figo's point of view, as an organisation that's passionate about working together with providers to improve access to quality, safe abortion care, this is really a helpful and exciting tool that can be used by so many healthcare providers. The field test showed that the app is a really handy mobile app for those seeking information and guidance on medical abortions, and it's available at your fingertips offline with this. As the WHO rolled this out, we're really excited to share this with our member societies, OBGYN societies, our networks, and really encourage everyone to try out the app and share with colleagues to do the same. Thank you. That's it from me. Next slide. Thank you very much.
Thank you so much, Jane. This was really interesting to hear the feedback from providers that have already used the app. So if you have any questions or comments for Jane, please use the Q&A box in this Zoom template. Okay, so let's move on to our next presenter. So as we heard, Jane already said that it has been pilot tested by OBGYNs in several countries. And one of the OBGYNs who tested the app is our next presenter. Yes, so it's Polyville Netin-Jurva, and he is OBGYN working in Rwanda, and he will now tell us a little bit more about how it was using the application. So welcome, Polyville. I turn it over to you.
Thank you very much, and I'm happy to share my experience using the app in clinical practice. And next, and as a care provider, usually the major things that you're concerned about is the client care, and yourself, the capacity building of yourself as a clinician, and also sharing information so that we can create the next generation care providers. Next. For the client care, I've used this app for a number of months now. So the app gives you an opportunity that will make sure that you're providing all necessary care that is required to the patient. And usually it takes all the complete care in its hands. And it prevents such forgetting things. That's some points that appear to be less important, but actually very critical for the patient outcome. For example, greeting the patient. So the app reminds you of that. And usually this thing of greeting the patient, even though sometimes we overlook it, but it welcomes the clients, and then the clients will know that this is the person who is actually going to give me the care I've been looking for. And it's very easy to navigate, and in simplified language, very simple language. There is no heavy technical medical languages in it. It's just the terms that we can use in our daily life. Next. So, for example, the app will give you an opportunity to look at, to receive the patient in all forms, at all level of the care. First contact, is she coming for follow-up care, or is she coming for post-abortion care? And then if it's for first contact, for example, it considers all the possible options that a patient would present in. And the information that in the app, when you navigate it, you realize it's a summary of all evidences that are in the safe abortion abortion guideline, and it considers also the client satisfaction. Next, talking about the client satisfaction. Next slide, please. For example, next, the app takes into consideration, for example, reminding you to provide information and offer counseling to the clients so that the clients can take informed decision making. And it takes all the levels that you will need in the next steps of management, and everything that is, for example, elaborated on this screen are included in the app. It does not only tell you establish this gestational age and leave you struggling with the gravidometer or using other calendar things. Next. So when you're using the app, it will open the calendar for you. And for example, if you have the LMP, if you know the LMP, the last menstrual period of the client, then it can help you determine the gestational age. And it also gives you an option to help the client choose between medical and surgical abortion, and also the eligibility criteria as well. Next. So when we're talking about eligibility criteria, for example, it gives you a range of medical conditions that would hinder your decision, that would interfere with decision making or give you a challenge. And if the client, for example, doesn't have any of these conditions, just click none. But if she has any of these conditions, next. If the client has any of these conditions, then it provides alert to caution for abortion on challenging medical conditions and tells you, please take caution. Next. So as clinicians, I would like to navigate through this case of Claudia. This is a fictional name that I created, but the case depicts the actual clients that I managed. 23 years old, who presents at abortion clinic for first time, and aware of her LMP, and which was consistent with 11 weeks and 4 days, and reports that she was raped, and she made a home pregnancy test that was positive. Next. So the next thing that comes to your mind that we as Claudia presents to you, now you know this. She's presenting for first contact for abortion care. Next, and the app will give you the opportunity of what to do right now. What am I going to do right now? So provide information, take pertinent history, and perform relevant physical examination. All these details, they are very summarized for you. Next. And then because Claudia is presenting for first time, you, after providing the information provision, you're likely to go to the pre-abortion care. Next. And with next again, with the pre-abortion care, we realize Claudia is less than 12 weeks of gestational age. So the app gives you an option to choose between first trimester, less than 12 weeks pregnancy, or above 12 weeks pregnancy. And if Claudia chooses medical abortion, and it gives you a range of 3 options. For example, if she opts for combination of mifepristone and misoprostol. Next, the app gives you some other hints about that. and what are the doses that you can give, for example, and the use of mifepristone and misoprostol as well. Next. It does not leave you from that only, but it also gives some other key points that you can consider. For example, considering that almost all women will experience some pain, and then this reminds you that you could consider pain management for this client. Next. And therefore, it is enhancing highest standard care and providing information that helps in patient education. And next. Now, you may wonder, you may look at all this information and still look at everything that is below, something that is that will help you to help Claudia. And when she comes back, for example, it has also a follow-up information. And you may wonder, does Claudia need contraception? So if she doesn't need, it's up to her to choose, but if she's eligible, is she really eligible for contraception? Next, the app gives you a summary of medical eligibility criteria for her, and everything follows either in one or two or four of the medical eligibility criteria. Next. And now the app also will help you. Next slide. The app will also help you to build yourself as a clinician. Next. Yeah, thank you. As a clinician, it summarizes all the evidences for you, and it is from a trusted source, WHO, which also gets all these recommendations from several evidences. And it prevents the need of keep taking pictures of posters on the walls. You know, there's the guidelines that we post on the walls, keeping having your eye on them, and those posters, sometimes they are not updated on daily or a continuous basis as evidences are released. But this one, somebody is there who is trusted, and they are updating these evidences within this app for you. Next. And this app, you can use it to share information with your colleagues. A single screenshot that you take in this with your phone and share it with your colleagues on the WhatsApp group or whatever, it serves a lot of information that can save a client somewhere without struggling. And you can use it to share with students, residents, midwives, nurses, everyone who is in the safe abortion care provision. And the app shared with the resident and students can also serve as a learning environment, serving all these flashcards in one go. Next, I thank you very much for your attention. And if you have questions, you're welcome.
Thank you so much, Polyfiland. I think you shared very nice experience and also lessons learned, how the tool can support your daily work and to ensure that you provide evidence-based care to clients. So thank you so much. So now we have come to the questions and answers session. So I have seen that you have provided, or you have put in many questions in the Q&A box. So I think we can start. So the first question, it's really about who can use this tool. Is it for an individual or is it for a hospital unit? So maybe Farid would like to answer this one. Over to you, Farid.
Thank you very much. I think this app is intended for healthcare providers. When we say healthcare providers, we're including all the broad range of category of healthcare providers where provision of abortion-related care is within their domain of work. So as long as it is part of their work, then they can use it. So the information is exactly what is currently available in the WHO guidelines. So there is nothing added, nothing omitted from that recommendation. So they can use it. Over to you.
Thank you, Farid. And now we have a technical questions that is makes me thinking about artificial intelligence, because somebody is asking, does the app tailor information based on training level of the user, based on information the user enters at startup? Polyfield, do you want to reply to this one?
Thank you. It's a great question. So currently the app, the way it is designed, when the time I've been using it, the app is not yet hard to tailor based on their personal information or personal details, but it provides a range of information so that everyone can utilize it at any level of care. For example, I think the question was like, does it tailor for example, for mid-level or high-level, advanced family planning specialists? From my experience, it's not yet on that level, but it gives access to anyone who would give care to who would meet an abortion client.
Thank you. Yes, it's correct. It's not yet adjusted. Even if we ask there in the beginning, are you OBGYN or midwife or nurse or something else? But it's just to collect the data. It's not to adjust the information that the app is provided. And similarly, we are asking from which country the user is calling from or using the app from. And it's not tailored to the legal situation in that country. So this is the information provided in the app is completely aligned with the abortion care guidelines. Then the provider needs to know the legal situation in his or her country. So that is very, very important. Okay. Then we have another question. If we are planning to have it in other languages, like we mentioned, the application is now only in English. And Farid mentioned that you can provide feedback after using the application, and the feedback will come directly to us. So if there is a strong feedback that it would be useful to have it in other languages, we can explore if it's feasible to have it translated in other languages, depending on the need of the audience of this application. Okay, I think I have another question for you, Farid. So what challenges did you encounter in developing this application? Over to you, Farid.
Thank you, Ulrika. Yeah, there were a few challenges when we were exploring the possible not only the navigation, but the extent of information to put on an app. So if we look at our guidelines, especially the most recent one is, unlike the previous one, it's a bit, there are many different recommendations, informations, the human rights aspects included, the law and policy parties included. So that was a bit bulkier. But when you comes to the clinical practice, there is a need to tear down the evidences to the bare minimum that would enable care providers give quality abortion care. So there needs to be, striking a balance from making it, too bulky, but at the same time not leaving out very critical information. So that was one of the challenges we
had. Thank you, Farid. So we have another question about plans to support countries to adapt the application based on the country's guidelines and policy environment. So maybe Farid, this one is also for you.
Yeah, so we will be working in close collaboration with our unit. So there is a dedicated unit for this one. So we will be working on something called digital adaptation kit, where WHO will put all the screenshots, the algorithms for public view, and people can go ahead and take the adaptation form, and countries can take those algorithms to their own settings based on what makes sense for them. But all what you see here is just the front end. So the back end, all the algorithms and the trees will be made available for public use. Over to you.
Okay, now I see a question that it's for Jane. So how does this application intersect with the institutional vision and mission of Figo? Jane, I give over to you.
Thank you. Thanks. And thanks for the question. So Figo's vision, it was on one of my slides earlier, but is a vision that women of the world achieve the highest possible standards of physical, mental, reproductive, and sexual health and well-being throughout their lives. So much of what Figo does to achieve this is to work through our member societies, the OBGYNs and other healthcare providers. And our work is really to support and enable those providers to provide quality care across all aspects of a woman's health. And so that includes sexual and reproductive health and in particular safe abortion. So when an app like this becomes available, one that can be a handy additional resource for healthcare providers and enables them to provide more comprehensive, more structured and consistent care, we really would encourage providers in our network and more widely to take a look at the app. And when we consider safe abortion in particular, I think resources like this mean that better care can be provided, which not only means healthier and happier women, but more women whose rights to safe and quality abortion can be met. So I think I mentioned earlier, Figo considers reproductive autonomy a basic human right, as well as safe abortion a time-sensitive and essential medical care. So bringing it back to this app, as well as all the other resources from the WHO, they all play a key part in our vision in women achieving the highest standards of health.
Thank you, Jane. Here it's another one for Polyfill. What features would you like to add to the app? You know, when you were using it in your daily work with clients, did you think about any other features that you would like to add? Over to you.
Thank you. The app, the way it is currently, is really comprehensive, and I personally love it, and I've recommended it to my colleagues at the clinical environment where I work. Maybe some few features, if the app can be used to keep some few informations, because that's what the questions that we were having at work. For example, when you finish, the app is not used to send informations at whatever, to WHO or whatever who developed. So it provides that security option. And some of the healthcare providers were feeling like, if after I have filled in my clients, can I be able, when the client comes back tomorrow or after tomorrow, do I have to restart over? Can it help me to make a follow-up? And which I think would probably be a whole new concept or new idea, but that was raised. And also, if it can provide reminder for healthcare providers, like to do follow-up, who to follow up. The current app also gives a very good reference for medical abortion. And I and my colleagues, we were discussing on whether the app there can be an app or the same app for surgical, detailing the surgical abortion as well.
Yes, I think you nailed it, Polyfiland, and that is something that we would need to explore. Thank you. Okay, so I have another question here. So I think this one could be for Farid. Is there a plan to study the impact of the application in terms of quality of abortion and other outcomes?
Yes, there are a number of analyses that we're planning to do. Just recently, one of the things we try to look at is the number of downloads we have, countries, based on geographic location. So we're trying to explore, okay, how can we evaluate and monitor the use of this application, not only the use, but also the impact it would have. So down the road, we will take a pause and make a survey with actual users and users. And just even from the pilot study, there were a number of indicators that we were able to look at in terms of fine-tuning the application itself, but also seeing the impact it can have. So this is something that we are exploring going further.
Thank you, Farid. I have one more question here for you. Was there a cost analysis done on the cost of downloading the app and the space it will take on the phone?
So cost analysis was not done. Currently, if my remember it correctly, the size of the app is very small, less than 5. I think the app from Android is about 5 megabits, and iOS could be even smaller. So in terms of occupying a space, it's quite small. It doesn't have much. It doesn't take much space, and it's available for free. The app is not paid like most medical apps. It is available for free, and anybody can use it for the intended purpose. The other thing is we will have to look in the future in terms of cost minimization, in terms of were there any referrals, unnecessary referrals avoided by utilization of this app. So it is something that we can explore in the future.
Thank you, Farid. I don't know if Polyfill, if you can answer this one. Is there a plan to include health information system like HMIS? Or maybe we give it to Farid. Yes, I give it to Farid.
Yeah.
Over to you.
Including HMIS is a bit complicated. We know how electronic medical records are globally a challenging thing to implement, and like doing any form of HMIS on a mobile app, given the number of security layers that you have, approval letters that you will have to go through, it will be very difficult to come up with a one size fits all HMIS system for the whole world. Over to you.
Thank you, Farid. Yes, we have to remember that this application is like the abortion care guidelines, that it's the evidence provided in an application. So it's not customized to one country. Okay, now I have a question for you, Polyfill. Were there instances where you changed or modified your course of management using the application?
Yeah, thank you very much. We had instances where actually we had some discussions with colleagues and the management care that we should give to the clients, and then we had to refer to the guidelines, the book itself. But the book because you have to navigate the pages, and then we went straight to the app. And the app helps us to come to one conclusion, one decision. So I think this was one client who had a low platelet level, and there was a discussion, and one team were like, if we do surgery, because it's called surgical management. I don't know who named it surgical, because it feels like you will open, you will do surgery, and therefore if someone has low platelets, you should be careful giving surgical management. And it's probably, this is one of the procedures that abortion is one, probably in the conditions where the surgical management is better than medical when someone has low platelets. And therefore we were talking about that. So in the one group, including myself, would be like, if you give medical management and she bleeds, how are you going to control this? Not like this. And then we referred to the app and brought us to one conclusion. So the conclusion, the app did not directly give that particular conclusion, but it says be cautious, be cautious. And then we went to other changes. And also my residents at work, when I was using the app for the first time, because initially I had issues with my phone, and I wanted to check if it was my phone not being able to navigate the app. And so I shared it with some of my residents so they can use and tell me what is their experience. So what they were having is that the app was easier for them to use, and they did not have to call me all the time for information. I mean, for guidance. So at the same time, the app was serving as a tool, and it helps them take decisions easier. And maybe to come a little bit to the earlier questions he asked me, one thing that I wish can be added to the app. So the app is a mobile on a mobile phone. So there is this thing associated with the mobile phone when you are talking to a client, when you are evaluating a client and you're on a mobile, the app, it appears like you're just distracted. You are doing your own things, you know. So, and the patient sometimes may get, disconnected from you, feeling like you're not giving enough attention. So, and there is in the patient education, the counseling and information, where the app advises to give, to greet the patient. What about advising in the app? Inform the client that you're using your phone as for her. It's actually for her, as a consultation. So that simple reminder, I mean, I eventually started using that to tell the clients that what I'm doing here, it's actually for you. It's not like I'm on WhatsApp or YouTube where you're telling me your private things. Thank you. I answered the questions. Thank you very much. I just wanted to highlight that can be also added in the information provision.
I think you raised a very important issue, Polyfiland, and we have discussed it many times and how to get around it. And your suggestion is a valid suggestion, and it could be included there. And another one could be that you try to look at it before you see the client, but of course you don't know all the answers. So yes, it's a little bit tricky, and I think you have a valid comment there to include the explanation in the app. We will look into it. Thank you. Okay, so this one is an important question. So can we use this application in any country? Farid, I think this is for you.
Yes, just like our guidelines are global guidelines, this application can also be utilized in any country where there is abortion care service delivery.
Yes, so once again, all the information that is in the application, it's also in the guidelines. It's packed in a easy way for the healthcare provider to access the information through the mobile phone. So that is really the only thing, that it's a job aid for the provider. Okay, let's see. Do we have any other questions? Yes, here we have one. I think this is for you as well, Farid. What about success indicators? How do you know it has been helpful for persons seeking care? Do you want to take this one, Farid?
Yeah. I think this is something that goes with what we spoke earlier. It is something that we'll have to go and do the survey and see the kind of impact it had got. We will not be able to make a direct association between abortion label impact and the application, but we can actually discuss with care providers, not only just a survey, but also a focus group discussion on how the application was used in terms of clinical service delivery.
Thank you so much, Farid. Thank you. And thank you, Polyfill and Jane, for participating in this webinar. So I hope you have all now downloaded the application. So I think we can go to the next slide. If you haven't downloaded yet, you can see the codes here, both for Apple and Android mobile phones. So please download it and start using it and provide feedback to us, because at the end of the the mobile application, there will be a place where you can provide feedback, and this will come directly to us so we can adjust and constantly approve the application so it fits the provider's needs. So thank you everyone for attending today's webinar. If you have any other questions, please contact us either through the application or through emails. And once you leave today's webinar, you will receive a follow-up email from IBP Network with a link to view a recording of today's webinar. And on behalf of WHO, HRP, and the IBP Network and our presenters, thank you so much for joining us today, and have a great rest of your day. Thank you so much.